for this invitation to attend this conference. أهلا وسهلا بكم وأنا سعيد جدا بتواجدي معكم. اليوم حنقدم لكم presentation on the use of artificial intelligence in cellular therapy. طبعا أنا أقدر إنه معظم الموجودين هنا يمكن ما يكونوا أطباء أو ما عندهم تخصص كبير بهالموضوع. شكرا. لكنه حاول أقدمها بطريقة مبسطة أوصل بها الفكرة ونشوف شلون نقدر نستفاد من هذا الموضوع سواء في العراق أو في بلدان الأخرى. I'm presenting this on your behalf, yes. على ما نبدي بشيء مقدمة بسيطة. كثير من عندنا سامعين اوريدي بموضوع يسموه الخلايا الجذعية أو العلاج الخلوي. هسه حاليا ينتشر بشكل كبير جدا سواء في منطقتنا العربية أو في الدول الأجنبية، وكذلك هذا العلاج هو علاج حاليا يثير قسم أمل ويثير شكوك في نفس الوقت. لأنه أمل لأنه لأول مرة في التاريخ في وجود الإنسانية صار الإنسان عنده قدرة على أنه يجدد الخلايا الموجودة في جسمه. هاي ما كان موجود قبل. Let's see now. They're working on it. على العموم لكنه من ناحية ثانية Thank you. شكرا. من ناحية ثانية الشكوك اللي يثيرها هو أنه للأسف ما موجود علم واسع لدى أغلب الناس أو حتى الأطباء كذلك يحاول استخدام هذه الطريقة فقط يساء استخدامها، ولذلك الارتفيشال انتليجنس دخل بهالموضوع لمساعدة الأطباء في هذا الموضوع. So let's start with my presentation. Yes, خلاص. شكرا. So what is cellular therapy? Cellular therapy is the concept of using new cells to replace damaged cells. So it's a very simple concept, but the concept is an innovative concept that has been started to be used in a lot of diseases. فهو استخدام الخلايا الجديدة لاستبدال الخلايا المتضررة بسبب أما العمر أو متضررة بسبب الأمراض، وكمان حنشوفها بالسلايدات المقبلة. It is a concept that is a step after donor transplantation. الكثير من عندنا يعرف إنه التبرع بالأعضاء وزراعة الأعضاء، فهذا شيء جديد. بدل ما نزرع عضو ناخذ خلية ونزرعها بالجسم، فهي أسهل بكثير من استبدال الأعضاء. هذا الكونسبت فهاي الخلايا احنا ناخذها يسموها ستيم سيلز. شنو ستيم سيلز؟ ستيم سيلز احنا عندنا بالجسم خلايا تقسم الى قسمين، قسم خلايا ماتشور او الخلايا المتطبعه والخلايا التي تنشئها. فالخلايا ستيم سيلز هي الخلايا اللي تنشئ خلايا الجسم، هي خلايا مثل على سبيل المثال خلايا الجنينيه او الخلايا اللي تؤخذ من بعض اجزاء الجسم، هي يسموها ستيم سيلز لانه تنشئ باقيه خلايا الجسم. فهاي الخلايا موجوده عندنا في الجسم في اماكن like in the bone, in the fat, in the teeth, in the brain. So we can take these from these organs and we can multiply them and we can re-inject them where it is needed. Unfortunately, the number of these stem cells decline with age. That's why people يصير عندهم aging، يصير عندهم كبر بالعمر بسبب نقص الstem cells. It is actually a project for becoming young, or defeating the effects of aging. نلاحظ هنا الستيم سيلز اللي هي تسوي سيلف ريبليكيت، يعني تنشأ معدل الخلايا الأخرى، وكذلك ممكن يصير معدل البون، الفات، المسلز، وكذلك ممكن relay or delay the apoptosis or cell death and reduce the inflammation. كثير من الأمراض اللي تصير بالجسم هي بسببها inflammation which destroys other cells. Now, this concept of stem cell therapy is not a new concept. It dates back to the 1950s. They were using stem cell therapy or bone marrow transplant, أو احنا نسميه زراعة نخاع العظم لعلاج الأمراض السرطانية اللي صارت الناس اللي تعرضوا للراديشن. فبدأ هذا العلاج من 1950. Then there was a breakthrough لما قاموا إنه يسوون cloning. Cloning هو إنشاء كائن حي من خلية عادية. أول كلونينج طبعا احنا نسمع لك يسموها الخروف دولي، لكنه حقيقة أول كلونينج هو بال 1960s. It was they actually made a frog from a somatic cell. John Gordon did that. وبعدين طبعا استخدام الخلايا هو مو شيء بسيط. ليش؟ لأنه there are different potentials اللي ممكن يصير، وكذلك أحيانا يصير بها errors سواء بالreplication أو error بالاستخدام، فذاك artificial intelligence would have a benefit in this. شافوا إنه استخدام الستيم سيلز إلى تأثير كبير في كثير من القضايا المستعصية that we are not found a cure yet, like stem cell, like spinal cord injury, إصابات الحبل الشوكي, diabetes, السكري, visual impairment. So these are all new techniques that we can use stem cells to help improve these diseases and also to replace the damaged tissues. The scientists have been finding that these cells, when they actually multiply and get more, they actually, there is a potential that they could become cancerous. So this is one of the things that artificial intelligence is very important, and I'll show you examples in the next few slides of how this is important. Now, one of the important applications of stem cell therapy اللي هي FDA approved، اللي هي تطبيقات واسعة، هي استخدام الستيم سيلز في أمراض الدم. فلذلك أول استخدام لهذا الموضوع كما قلنا بدأ بالخمسينيات وبالستينيات. They were able to get normal cells, normal blood cells from hematopoietic cells, which is كان breakthrough. إنه أول تحصيل لخلايا ستم عادية من خلايا ستم سيلز خارج الجسم. إلى وذلك they were able to use it for treating leukemia, myelomas, lymphomas، كلها أمراض الدم، أمراض الدم الخفيفة اللي فباختصار شو يسوون the subject is المريض يعطوه علاج كيميائي وعلاج راديشن، يقتلون كل خلايا الطبيعية أو هي الخلايا الموجودة عنده هو المريض اللي هي الخلايا السرطانية، وبعدين يأخذون الخلايا الستيم سيلز يدخلوها فالخلايا الستيم سيلز تقوم تنتج الخلايا اللي يحتاجها الجسم وتعوض عن الخلايا السرطانية اللي قتلناها. وفي اليابان في 2006 this was the first time that they were able to produce stem cells from normal human cells. Now we talked about frogs, but in 2006 أخذوا خلية من خلايا الجلد وحولوها إلى stem cell, which was a breakthrough. This was done by Yamanaka and Takahashi in Japan. So we can see here the potential use of stem cells. This is something that now there are increasing number of stem cell therapy centers in the world, in the US, in China, in the Europe, and we would like to bring this new technique, new technology here to Iraq. فنرى أنه ممكن استخدامه في قضايا تتعلق بالدماغ مثل stroke, Alzheimer, Parkinson, blindness, deafness, even baldness, and other diseases in the body such as Crohn's disease, osteoarthritis, خشونة العظام, خشونة المفاصل, حتى أمراض القلب, لأن أمراض القلب كثير منها بسبب إنه ضمور عضلات القلب. This is now what has artificial intelligence to do in all this? This is probably the question that we all have in mind. So to start with, I will start with artificial intelligence in medicine, and then we'll focus on stem cell therapy. Okay. So basically, artificial intelligence in medicine has been used over the last decade and has improved the viability, functionality, biosafety, and bioefficacy of stem cell therapy. So this has been found to increase the efficacy of the treatments that we do to the patients. And it's very surprising that artificial intelligence, the market for artificial intelligence has actually increased 10 times over just a few years. You see, in 2014, the market for artificial intelligence was only 600 million, and in 2021, so over just a matter of 7 years, it had increased by 4 to 6.6 billion. So this is something that will help us to perform better in our life and in our treatments. So in this, we see that there are two types of applications for artificial intelligence in medicine. Some of them are virtual, so such as having deep learning to help us to assess electronic health records and help physicians who are counseling for various treatments, and it will propose the treatments to the physicians. And the second aspect is a physical aspect where the robots are employed to help elderly patients or even to assist surgeons in their treatment. Now we come to the examples. I'll just go through them quickly to show you where artificial intelligence is important in stem cell therapy. So I told you about the use of stem cell therapy in malignant blood disease, lymphoma, leukemia. They actually developed a machine learning algorithm to predict the outcome of these patients over 2 years. So لأنه هذه القضية مثل ما قلنا إنه يحتاجون أول شيء يقتلون كل الخلايا السرطانية الموجودة بالجسم فقد يأثر على الشخص. They had an algorithm to actually tell them which patients will benefit, which patients will not benefit from it. And then they have also used machine learning to identify stem cell colonies. فلما ينشئون الstem cells كانت الطريقة العادية هم إنه يشوفون تحت الميكروسكوب يشوفون إنه هل الخلية كملت نضجها أو شيء، لكن بعدين قاموا يستخدمون الماشين learning and even the neural network approach to actually identify when these cells are ready. So شكلها يكون طبيعي، وكذلك not only their shape but even the functionality. So they have actually made neural networks to identify the functionality of the cells. And they also, this is a very non-invasive technique. So basically, the networks will identify the functionality of these, like here in this, for example, in this example, we have deep learning that predicts function of live retinal pigment epithelium from quantitative microscopy. So basically, when they get the stem cells, في ناس يصير عندهم عمى ألوان أو عمى ضمور في أعصاب البصر. فيجيبون stem cells, they grow these stem cells to become retinal pigment cells. في السابق كان إنه فقط ينظرها عن طريق الميكروسكوبي ما عرفت إنه هل نضجت أو لا، لكن حاليا أكو new artificial intelligence systems to get that done. كذلك في الكانسر cells أكو cancer stem cells. So the artificial intelligence is important in detection of cancer stem cells. not only that, but they can also show, using artificial intelligence programs, the response of the stem cells to medicines. So here we have for heart muscles. So basically, they can show using new techniques like machine learning. They can show the effect of the medication on the heart. Okay, so I'll have to go through this quickly. So in summary, artificial intelligence helps us in the following. First of all, to establish diagnosis. So it can become more precise than humans to establish diagnosis, to select medication, formulate risks and benefits, and stratify the medical errors. So it reduces the medical errors. And this is by establishing algorithms, so neural networks, to help in this. Now, it can also improve the accessibility, diagnose earlier, minimize expenditures, assist in surgical procedures with efficiency, and enhance human skills. Now, the risks of artificial intelligence, this is also something we have to consider. There are injuries, if there are errors, as we know, sometimes you can have machine errors, so this could produce injuries. Privacy issues, and now we spoke with Dr. Imad about cybersecurity, because cybersecurity is very important in this aspect to ensure privacy, inequality, discrimination, and professional restructure. Because if you have a structure of a medical system, you have to restructure it to introduce artificial intelligence, so this will be additional cost. As we mentioned, all the previous application for artificial intelligence. I'll just end with this, if you give me 1 minute. Now, there are millions of cells, and there are millions, and there are thousands of diseases. How would you know which cell would be suitable for this disease? Now, human minds are very limited in comparing this, but with deep learning and with you could actually analyze the cells, analyze the disease, and make the match that is between them. Thank you very much.
Thank you very much. Thank you.